Hey everyone, I want to talk to you a little bit about carpal tunnel syndrome. It's something we see more and more commonly these days with the usage of computers, home use, and also office work, where people are on their computers all day long, where their hands are in extension. We also see it a lot with waitresses and people who have their hands bent backwards a lot for different functions that they have to perform. Anyways, let's talk about the wrist. The wrist is made up of two rows of bones that form an arch. Underneath that arch are the blood vessels and the nerves. They run through there. When your hand's in extension all day, it flattens out that arch and tends to put pressure on those nerves and blood vessels. That's where people get pain and numbness in their hands from. So you go to the doctor, they diagnose you with carpal tunnel syndrome, they send you through physical therapy, and then if that doesn't work, they say, okay, let's do surgery. The surgery itself is relatively ineffective because what they do is they basically go in there and roto-rooter out that area, make room for those nerves and blood vessels to come through. However, what happens after surgery? What does the body heal with? It heals with more scar tissue, and the body tends to overheal things. So when those nerves and blood vessels go through, initially those people feel much better. Ask them 6 months down the road or a year down the road how they feel though, and it's usually not much improvement. What we can do with carpal tunnel syndrome though is very, very effective chiropractically, because as we get those joints moving and work on the wrist, get the bones functioning more like they're supposed to, break up that scar tissue so that it resorbs into the system, and if we get the joints functioning correctly, there won't be a whole lot of scar tissue. We can give you some exercises at home that you can do to help it get better quicker, and it's a much more effective treatment for carpal tunnel syndrome. We have a lot of success with it actually. It's one of those things that people who have the surgery are usually not happy a year down the road, whereas we're doing a much more conservative approach and we're able to take care of it much more effectively. So anyway, I thought I'd bring that up tonight. I hope it helps. If you have any questions, please call and ask me. Also, I hope you're sharing our videos if you like them, because if they're helping other people, you're helping us get the word out. So anyways, I appreciate it. Have a great day. We'll talk to you soon.